Hello, Professor Celeste and fellow classmates. My name is Christy Johnson, and I'll be doing my project on the causes and effects of mental illness during the forgotten years. These would include the years 6 to 11 years old, sometimes 12. And I chose to do my project on this subject because I have family members who suffers with mental illness. I also have a 65-year-old brother who has been dealing with the challenges of mental illness for over 40 years now. I have been his guardian for 12 years, and I have seen a lot of the behaviors and signs and symptoms that I will be discussing today. I know mental illness is something maybe everybody have one or two people in their family that's dealing with mental illness or either know someone. So it's very prevalent and it's a really serious matter. And I was just interested in the causes and effects of mental illness, how young you can actually be afflicted with mental illness, and what causes it. And I found out by doing my research that a lot of it can even start as young as in the womb. So I thought that was very interesting, and I will. I'm looking forward to sharing it with you all. I hope you enjoy it. Thank you. I'd like to start off with the general characteristics of a child between the ages of 6 and 11 years old. I'm going to begin with their physical growth. Most children that age have steady physical growth, and normally children of the same chronological age may vary greatly in stature, weight, and sexual development. And this is because everybody grows at a different pace, at a different rate. And this is primarily because of genetics and environmental influences. So you can take on the characteristics, either your mom or your dad or someone else in the family. And as far as your environment, if you're getting proper nutrition, getting proper care, and things of that sort. And also, this is a time of uneven growth of bone, muscles, and organs, which can result in awkward appearance. Some children might be more taller and much bigger than other children, have big feet, that type of thing, so they might feel a little awkward. And this is also the onset of puberty and can present difficulties for girls as well as boys. For the girls, they might grow mature faster than others as far as, their breasts and things of that sort. And for boys normally are more, have more adult expectations, that which is appropriate for older boys. And then some really find out about the adolescence like early on and start to question and want to know a lot about their sexuality. So now I want to talk about the mental development. This is the time when the kids they begin to show more independence from parents and family, and this is around the time that they start developing outside relationships, such as with their friends and teachers, and just begin to interact socially with others. They also begin to think about their own behavior and see consequences for their actions. So this is the time where they also think about things a little more before they act, because they start to realize that there are some ramifications for their actions, good or bad. They begin to focus less on themselves and have more concern for others. They begin to see others' point of view more clearly. So they don't have, I would say, tunnel vision. They start to take in others' perspectives on things. They also begin to track back events to explain certain situations, understand more about his or her place in the world. They start to think about the future, and they begin to build a self-image as a worker. They should have mastery of reading and writing, favor active listening, their attention span increases. They begin to focus attention and take time to search for needed information. They also begin to develop plans in order to meet goals. So now is the time they're starting to focus on a lot of what their interests are and what they want to do. And they also have greater memory capability due to automatic routine, such as their daily ADL, such as washing, brushing their teeth, combing their hair, and things of that sort. Next, I want to talk about emotional development. This is the ability to mentally organize and articulate emotional experiences. So when you organize in your emotions, you basically put them into categories, like whether you want to talk about something, or you might want to just reflect, or you might need to grieve about a situation, or maybe just take time out for yourself. Cognitive control of emotional arousal. That's basically your responses to your external and internal stimuli. Use of emotions as internal monitoring and guidance systems. So you're basically basing your behavior or in how you choose to behave. You basing that on how you feel inside. Your ability to remain focused on goal directed action. Ability to understand and use the concept of planning, ability to view tasks incrementally. So you take tasks, little tasks in increments, and you work on one task at a time. Then you have influence of internalized feelings like your self pride and shame that also will determine how you behave, have an effect on your behavior, and your capacity to tolerate conflicting feelings. Like you say you want to smoke, but you know it's not good for you. And increasingly effective defense mechanisms, such as acting out, pretending not to care, and avoidance. So, in order to not address some issues or recognize them, then you want to act out and not show your emotions. Next, I want to talk about moral development. During this particular time, children are predominantly egocentric in their thinking, which means that everything is all about me. How can I please me? How can you please me? I want to do what I want to do, and that's all that matters. But at the same time, they also beginning to develop a conscience, and so they are aware that the universe don't revolve around them, and they start to realize that they move from how will I benefit from doing this to wanting to gain social approval and live up to the expectations of people close to them. So it goes from, if I do this, what am I going to get in return? What what pleasure am I going to get from this? If they're not going to get any pleasure from it, or if they're not going to gain anything from it, they don't want to do it. But they start to gain social approval from their family and friends and teachers, and they start to want to please everybody and get acceptance. And then they may begin to place other needs before their own. So now they're starting to care about those around them and people that they care about, and they start to want to please them and once again um, gain that acceptance from others. And their moral thinking abilities may not always be reflected in their behavior. So, although they might know what to do, what to say, and how to act, they may not always reflect that. So, now I would like to discuss the diagnostic criteria of children with mental illness and disorders. Childhood disorders are not part of the expected normal developmental process. This is obviously because they have a lot of issues going on, and it's just not a part of the normal developmental process. So they might be lacking in a lot of areas as far as moral development, as far as mental development, and of course, as far as the psychosocial, cognitive. things of that sort. And the children's behavior and or development deviates from normal age appropriate behavior and or development. So a lot of children with mental illnesses, of course, they have like mood swings, or they might act out, or they thought process be different than that over a normal child, because a lot of times they've gone through so much, and so they have a lot to deal with. They have things that have affected them at such a young age, which has affected them both mentally, emotionally, psychologically, as well as physically. So a lot of times you can tell somewhat like a child who's going through mental illness as opposed to one that is developing normally. Statistics for children suffering with mental illness and or disorders. Between 17.6% and 22% of children have symptoms of one or more childhood disorders. 15% of American children suffer from a mental illness that is severe enough to cause some level of functional impairment. Anxiety disorder is the most common mental illness among children today, with prevalence rates ranging between 10% and 20%. And as a result of these mental illnesses and disorders, primarily anxiety, they very well could follow you straight into adulthood. So once in adulthood, you could suffer from major depression, um, which could lead to thoughts or ideations of suicide, and in some cases, homicide as well. And there's a great chance that during this time, you probably will have experienced several hospitalizations, or keep going into the hospital, in and out the hospital, in and out the hospital. And that could be because of a number of things, not being on the right medication, or consistently doing the same things, or staying in the same environment, or dealing with the same people. So it's a lot of factors associated with that. And next, I'd like to talk about the forms and causes of mental disorders. A lot of people seem to think that having a mental illness is a sign of weakness, that you can't deal with reality, or you have no coping skills, or you can't deal with stress very well. But there are actually valid reasons for mental illness, and one is the brain based disorder. And one could be caused by a neurochemical problem, which is the chemicals that's in your brain. And these chemicals basically allow us to carry out our daily functions, such as generating movement and speaking and talking and thinking, listening. It basically regulates our system. Or it could be innate, which means it appeared at or shortly after birth, which um, primarily happened during the carrying of the fetus. Something could have went wrong while you were pregnant. And then there's the physical stress, such as illness or injury, that could have a major impact on your body. And a lot of times you have physical problems that will lead to other problems with the body as well as mental. And then it could be from emotional stress, such as a trauma or loss, where you could have lost a loved one, your mom or dad or child or something like that. Or you could have had an accident or something like that that caused a lot of injury to your brain. So there's a lot of reasons why people do have mental illness.